Hello, I am Dr. Bhagyalakshmi, Senior Homeopathic General Physician at Ribha Homeopathy. I have clinics in Raman Nagar, Indira Nagar, Bengaluru. I have been practicing from 22 years. Infertility. Infertility means not being able to become pregnant after a year of trying for baby. There are two types of infertility: primary infertility and secondary infertility. Primary infertility is when a couple has not conceived after trying for at least 12 months without using birth control. Secondary infertility is when they have previously conceived but are no longer able to get baby. Causes for infertility in women and men. Sometimes will be in both. Now we will see causes in men. The following are common causes of infertility in men. If there is sperm count less, then it will happen. The following problems are possible. Low sperm count. The man ejaculates a low number of sperm. The sperm count of under 15 million is considered low. Around 1/3 of couples have difficulty conceiving due to low sperm count. Low sperm mobility. If sperm is not able to swim as well as they should to reach the egg, then it will happen. So, abnormal sperm count. The sperm may have an unusual shape, making it harder to move and fertilize an egg. A medical condition, this could be a testicular infection, cancer or any surgery. Then also infertility will happen. Hormonal imbalances like hypogonadism, for example, can lead to testosterone deficiency in hypogonadism. In some people, genetic factors will happen. Genetic factors means hereditary, we can say. Then mumps. If this occurs after puberty, inflammation of the testicles may affect sperm production. So then infertility will happen. In some diseases like Cushing syndrome, diabetes, thyroid problems, in anemia also sperm count will be less. Some medications increase the risk of fertility. In men, main medicines anti-inflammatory drugs can significantly lower a man's sperm count. It is often prescribed for Crohn's disease or rheumatoid arthritis. In some people, if they take more alcohol, then also sperm count will be less. Overweight also one of the reason in men, we can say. And if there is mental stress more, then also sperm count, sperm motility, sperm size also will be less. Now I will tell briefly about causes in women. Infertility in women can also have a range of causes. Main factor nowadays we are seeing age. Above 35 years, it is very difficult to get good quality of egg, they won't get. So that is the main factor. Smoking. Smoking significantly increases the risk of infertility in both men and women. The effects of fertility treatment. Smoking during pregnancy increases the chance of pregnancy loss. Passive smoking has also been linked to lower fertility. Alcohol also one of the major reason nowadays we are seeing in women. Any amount of alcohol consumption can affect the chance of conceiving. Being obese or overweight also one of the major role in women. This can increase the risk of infertility in women as well as men also. Eating disorders. If any eating disorders leads to serious weight loss or obese, fertility problems may rise. Then diet. A lack of folic acid iron, zinc, vitamin B can affect the fertility. Women who are at risk, including those on a vegan diet, should ask the doctor about supplements, and they have to take advice from their consultant doctor. Exercise. Both too much or too little exercise can lead to fertility problems. Sexually transmitted infections like chlamydia can damage the fallopian tube in a woman. Exposure to some chemicals like some pesticides, herbicides, metals such as lead and solvents have been linked to fertility problems in both men and women. And mental stress. This may affect females' ovulation, and male sperm production can lead to reduced sexual activity. Then ovulation disorders appear to be the most common cause of infertility in women. Ovulation is the monthly release of an egg. The egg may never be released. They may only be released in some cycles. Ovulation disorders can be due to premature ovarian failure. The ovaries stop working before the age of 40 years. Next reason is polycystic ovary syndrome. The ovaries function normally won't work. In this, ovulation may not occur. So, in ovaries, so many cysts will be there. So, hormone disturbance will occur. Then, fertility will be the problem. Next problem is hyperprolactinemia. If prolactin levels are high, then the woman is not pregnant, and breastfeeding, it may affect ovulation and fertility. Poor egg quality. Eggs that are damaged, develop genetic abnormalities, cannot sustain a pregnancy. The older woman is, the higher the risk. Next cause is thyroid problems. An overactive or underactive thyroid gland can lead to hormonal imbalance. Next, chronic conditions like cancers, AIDS also will be problem for fertility. Problems of the uterus or fallopian tubes can prevent the egg from traveling from ovary to the uterus or womb. If the egg does not travel, it can be harder to conceive naturally. Other causes include pelvic surgery can sometimes cause scarring or damage to the fallopian tubes. Cervical surgery can sometimes cause scarring or shortening of the cervix. The cervix is the neck of the uterus. Submucosal fibroids next. Benign or non-cancerous tumors occur in the muscular wall of the uterus. They can interfere with the implantation or block the fallopian tube, preventing sperm from fertilizing the egg. Long-term use of aspirin or ibuprofen may make it harder to conceive. Sometimes chemotherapy also interfere in egg release, and radiation therapy also interfere in fertility. What are the tests to be done in infertility cases? In female, we have to suggest for ultrasonography, hormonal tests like FSH, TSH, LH, AMN, like this. In men, sperm analysis we have to see. Treatment for infertility in homeopathy. In homeopathy, we give remedies according to their problems. For example, if there is blockage in fallopian tube, for that we give remedies without any surgery. So like tuberculinum, thuja, so many drugs we have. According to their problem, according to their symptoms, we give. In men, if there is less sperm count, we give remedies like X-ray. If there is varicocele like pulsatilla, if there is hydrocele like thuja, like this we give. In Ribha homeopathy, results are encouraging and getting up to 70% fertility rate.